Good morning, everybody, and welcome to Edinburgh's Bio Quarter. Now, it's no secret that creating the NHS is Labour's proudest achievement. And over the last few years, I've spent time with some true heroes, NHS staff, who are truly the backbone of our NHS. And I thank them for the life-changing, life-saving work that they do. And it's incredible to be here today, really in the heart of Edinburgh's Bio Quarter, where groundbreaking research is taking place, which will transform lives for generations to come. But this cutting-edge work is happening despite the efforts of both of Scotland's governments, not because of them. And after 14 years of Tory chaos and 17 years of SNP failure in Scotland, the NHS is truly on its knees. Waiting lists have skyrocketed, and they continue to do so. In Scotland, almost 1 in 6 people are waiting. And whether you're waiting for cancer treatment, a hip replacement, or urgent child mental health support, you can no longer guarantee you'll receive the care you need when you need it most. And that is a national scandal. Just this week, we learnt that the SNP has presided over a two-tier system of healthcare, paying £850 million of public money to send patients to private hospitals to get the treatment our struggling NHS hospitals can't provide. But Labour isn't just proud of creating the NHS, we're deeply committed to securing its future. A Labour government will deliver 160,000 more appointments every year for patients here in Scotland, reducing waiting lists. We will value our NHS workforce and show them the respect they deserve with a proper retention plan, better working conditions and time for training. And across the UK, we will invest £10 billion in research and development so that Scotland's world-class, cutting-edge research institutions can continue to thrive. In 1948, Labour created the NHS. In 1997, Labour rescued the NHS. And on the 5th of July, which will be the 76th birthday of the NHS, Labour will work to restore it once again. But you know, this change is only possible if we vote for it. And to tell you why that change is so important, I'm delighted to introduce Oliver Thomas, who is a junior doctor, and we're pleased he's taken the time out of his busy day to join us. Oliver.
Good morning. It's fantastic to be here today to talk about the Labour movement's proudest achievement, our NHS. I am a junior doctor. I've been a junior doctor for over 10 years, and it's a fantastic job. It's absolutely brilliant. It's a privilege being trusted to help people at some of the hardest and darkest times of their lives. And I'm hardly unique. Our NHS in Scotland is staffed by tens of thousands of the most dedicated, passionate, hard-working people. But providing our patients with the high-quality care we want to is harder than it should be. And we see this in our acute hospitals. It's heartbreaking seeing patients who have had no choice but to come to a hospital because our community and primary care services are stretched beyond capacity. To see patients who haven't been able to get appointments with their GPs or with their dentists. To see patients struggling with the complications of conditions that they're on long waiting lists trying to get sorted out. And to see patients who are in hospital well enough to go home, but are stuck away from home, away from their families, because of a lack of capacity in domiciliary care and care packages. And I see the knock-on effects this has across the system. Overwhelmed emergency departments. And it's the normalisation of long bed waits and long ambulance waits. It's staff stretched beyond breaking point, trying to care for more patients than they realistically can. And enough is enough. The time has come for change. The next Parliament will see the 80th birthday of the NHS, but for the NHS to be fit for another 80 years, we need a government that recognises the importance of health promotion, of social care, of mental health services, of community pharmacies, of embedding care in the community and treating people at home. We need a government that will keep our NHS public, and will do whatever it takes to support and to retain the incredible staff throughout the system. That's why it's so important that Labour has set out a clear plan for how to do that. 160,000 new appointments to tackle waiting lists, plans to reduce bureaucracy and to empower nurses and doctors. This is the change the NHS needs. On the 4th of July, change is on the ballot paper, the change to save our NHS. Thank you.
I'll just put my glasses on. Thanks for having me here today, and thanks, Oliver. I'm Carolyn Hunter. I'm a carer for my daughter, Freya. Freya's 14 years old. She has severe complex health and disabilities, and looked after by myself and a team of nursing staff at home 24/7. And we know firsthand what 14 years of government failure means. And this is from the cost of living crisis to the housing crisis, to the immense pressure on our NHS. Families like mine end up having to pay more for everything that we need because governments aren't delivering. And everything is so much more expensive when you live in the world of disabilities. So when the energy crisis began 2.5 years ago, I was presented with an energy bill of £855 a month, and this is because of the cost of running of the equipment that I need to keep my daughter alive at home, and heating the house, using appliances. I have lots of staff coming in to look after my daughter, and there's lots of hidden costs that nobody sort of thinks about, and those costs were going to mean that I was going to have to pay all that money out every month, and I just couldn't afford it. And at that point, I had just started working, but I still couldn't afford it. So this is not just happening to me. This is happening to lots of other families in similar circumstances to me, and they're suffering. They've been suffering now for over 2 years with bills they cannot afford, and they're now in lots of debt, and they'll never be able to get out of poverty. I was lucky enough, because I was campaigning a lot, to receive some support from lots of kind people all over the world. And I'm in a position where I can pay my bills, but I have and I will continue to fight for the people that I'm supporting in similar circumstances to me, because I know that they are suffering immensely, not just with bills, financial, but looking after their child who is extremely health vulnerable. So I'd like to just turn to health and social care system, and I have a huge amount of experience with health and social care system because of my daughter Freya's health needs. And I see every day the incredible work that the staff do under the immense pressure that they're under. But I also see the lack of staff, which has a massive impact on when my daughter's in hospital and she's in an acute setting. There's not enough staff. That's dangerous for my daughter because she's vulnerable anyway, but she needs more support when she's in hospital. The lack of funding. And this is not just in the NHS, this is also in the community. You know, when people are being discharged, they need equipment, they need to have somebody to make that assessment. There's not enough people on the ground to be able to provide that. And there's no support from the government. I don't see it. I've been living this now for 14 years, and I think that's 14 years of the government that we've had, and it's not been delivered. There's not enough staff to cover sick leave, and the staff that are working, they're exhausted because they're having to cover other people's shifts. I have staff coming into my home all the time, and they're exhausted because they are covering shifts that people are off sick, and I think it's due to exhaustion. You know, probably a lot of people have, you know, their mental health has declined because they're not happy within their work. And they're also suffering the cost of living crisis as well, and all the stresses that we're all suffering. There have been times that my daughter has had to go into hospital because there's simply not enough staff to cover our NHS care at home. And this is not safe for my daughter to go into hospital. If she catches an infection when she's well, that could put her on life support, and I could lose my daughter because of that. And also, there's not enough staff in the ward to look after my daughter when she does have to go into hospital. And this is a massive cost on the NHS, because I need to get an ambulance for my daughter to take her to hospital, and then she needs to maybe stay for a night, and if she ends up catching an infection, she'll have to stay for longer. So we need to keep our children, we need to keep our loved ones at home in the community. We need to have the staff and the resources within our communities to be able to cope with that. The institutions that we rely on are absolutely broken. Disabled people are living in homes that are not fit for purpose as well, meaning more time in hospital. There's levels of mould in homes because people can't afford their energy bills. So this is also going to be impacting on respiratory health. I was speaking to somebody from the council not that long ago, and there's been a massive increase in problems with mould in homes and council and the local authority housing. It's just really dangerous for people to be living in conditions like that, and there's more of that going on now. And a lack of social care means that people are stuck in hospital needlessly. And like I've just said about Freya, she could end up having to go to hospital because I don't have enough people to look after her at home. I employ my own staff as well through a self-directed support budget, and the amount of money that I'm allowed to pay them is ridiculous. And I struggle to get staff. And they're doing the same job as the Band 5, Band 6 nurses that are coming in to look after Freya at the same time. So something needs to change. Emotionally, practically and financially, families like mine are being failed all the time, and we need change. This cannot be as good as it gets. In this election, we have a chance to elect a Labour government that will rebuild our NHS, support social care and tackle the cost of living crisis. This is an opportunity for change we cannot afford to miss.
Good morning. My name is Margaret McCarthy, and I'm a registered general nurse working in health improvement in NHS Greater Glasgow and Clyde. As an active Unison member, I know the situation in the NHS from the coalface. I know the impact that the brutal SNP and Tory cuts have had, and how our NHS has been failed by governments both in Westminster and in Holyrood. Staff are on their knees. They continue to do the very, very best they can for their patients, but it is now at a cost to their own health. And we are seeing increasing numbers of staff absent due to overwork and stress. There is currently understaffing across all areas of the NHS, in the wards, in A&E departments, in health visiting, in community mental health. The list is endless. In Glasgow City HSCP, so in the communities, NHS staff are facing cuts. And we're talking about cuts to health visitors, cuts to staff and services that support patients with mental ill health, cuts to staff and services designed to support people to remain in the community and prevent admission to hospital. So we're talking there about hospital at home, home first response and care home liaison staff. These cuts are harming our NHS. They're harming workers and they're harming patients. And we know that under the SNP and Tories, population in Glasgow is in decline. This is for the first time since the 19th century. It's a disgrace. This cannot be allowed to go on. We need action now to save our NHS so that we can serve the people of Scotland. And Labour's plans to tackle the bureaucracy and empower NHS workers and invest in our NHS is exactly what we need. This election is our chance to end 14 years of Tory chaos and to send a message to the SNP that Labour is ready to save our NHS. This is an opportunity for change, and we cannot afford to miss it. I now have great pleasure to introduce the Scottish leader for the Scottish Labour Party, Anas Sarwar.
Robert. Thank you so much, Mags. I've known you for a while, and I know how hard you work, but also how well you speak for nurses who are under immense pressure throughout our country. So a big thank you to you, Mags. And before I go on, can I just say it's an absolute pleasure to be here in Edinburgh's BioQuarter and to see the fantastic research that is being done here. And I actually want to repeat something that will stay with me actually for the rest of this campaign, but even more importantly, beyond it. And that's what one of the professors who specialises in liver health said to me upstairs. And that was, Scotland's ambition shouldn't be to be the best in the UK. Scotland's ambition should be to be the best in the world. That's my ethos. That's our ethos. I'm glad that's the BioQuarter's ethos. And thank you, of course, to Jackie, who is leading our work on developing our NHS policy as we head beyond this election into the election in 2026, as well as being the co-chair of our campaign. So a big cheer for Jackie Baillie, please. And thank you to you, Oliver, for the immense contribution you are making to our National Health Service. I know how much pressure junior doctors in particular are on, so thank you so much for taking the time to be here and for your service. And to you, Carolyn, your story actually epitomises the whole point of why we have a National Health Service and why we've got to have a care service fit for the future. And I know the sacrifices you personally make to look out after for Freya. And as we mark National Carers Week this week, of course we thank you, Carolyn, but we thank carers across the country who continue to go above and beyond. So we have a big round of applause, please, for all the carers across the country. Friends, our National Health Service touches the lives of everyone in this country, but the NHS is personal to me. I studied dentistry at the University of Glasgow, and actually the debate last night, I don't know if anybody watched it, the debate last night was actually in the Bute Hall, the very same Bute Hall that my wife and I both graduated in as dentists back many moons ago from now. Because my first job was in the NHS as a dentist in Paisley. And I saw firsthand the impact of government failures on the poorest communities in our country. High levels of tooth decay among adults. Children turning up for checkups with signs of decay before they'd even started primary school. And tragically, I even had the terrible circumstances where for some teenagers, we would have to do full dental clearances and install dentures because of the damage of drug addiction and methadone in particular. And because of years of SNP mismanagement of our NHS, the dentistry crisis in Scotland has only deepened since then. And yesterday I got the scrubs back on. I was in Fife visiting a local dentist. But that's a practice that's been forced to make the heartbreaking decision of stop taking new patients because it can't cope with the demand. They aren't taking NHS patients. And it's a problem mirrored everywhere across Scotland, including right here in Edinburgh. This city has a long and proud history of dental care. It's home to the father of dental training, Dr. John Smith. And yet in Edinburgh, as elsewhere, barely a handful of practices are now taking on new NHS patients. It's got so bad that actually our fantastic local candidate for Edinburgh East and Musselburgh, Chris Murray, is amongst those who spent months waiting for an appointment, just like so many other residents. I'm going to try and give him some of my dental expertise after the event is over today. Actually, his mum used to be one of my patients, but that's another story. Across Scotland, around 4 out of 5 NHS practices are closed to new patients. Those who can afford it are now turning in desperation to private healthcare in order to stop the pain. And the families who rely most on NHS dental care now tragically have the least chance of getting it. This is the reality of the NHS in Scotland under the SNP. And that's why this election can and must be a turning point for our NHS. In 1945, a Labour government founded our National Health Service on principles that have stood the test of time. That the best health services should be available for everyone, free for all. Money should never be a passport to the best treatment. People should get the best that modern science can offer. The Labour Party will always defend the NHS. Yes, it's in my DNA, but it's in the Labour Party's DNA. Because we created the NHS, we saved the NHS in 1997, and we will save the NHS again. And today I welcome the opportunity to set out the first steps we will take on that recovery mission. Because make no mistake, and you've heard it from our speakers today, our NHS is on its knees despite the best efforts of our phenomenal NHS staff who continue to go above and beyond. And let's not forget that while the SNP may want to blame everyone else, every single decision on NHS funding, strategy and service delivery in Scotland is made in Holyrood, not Westminster. So let's look at that SNP record. Nearly 1 in 6 Scots, 840,000 of our fellow citizens are sitting on NHS waiting lists, waiting for appointments, waiting for tests and waiting for treatment. That is a national emergency. A staggering 87,000 have waited over a year. More than 7,000 Scots have waited over 2 years for inpatient treatment. And the 62-day treatment standard for cancer has not been met since 2012. That's 12 years. And more than 24,000 Scots are on a waiting list for specialist mental health support. And more people wait 12 hours in A&E today than waited 4 hours when the SNP first came to power. And that list goes on and on and on. Because the damage inflicted on our NHS by the SNP is an absolute scandal. SNP First Minister after SNP First Minister, SNP Health Secretary after SNP Health Secretary should hang their heads in shame for breaking something so precious to us all. And the impact of failure is that Scotland now has a 2-tier health system. Every single person will know someone who's been forced to scrape together cash to go private. 40% of hip and knee replacements carried out in Scotland are now being paid for privately. And the total number of private hospital admissions in Scotland in 2023 rose to 46,000, a third higher than in 2019. Now, the Nationalist failure to adequately strengthen our workforce and fund vital services over the last 17 years has led to this 2-tier system. So let me make this crystal clear to the SNP. A Labour government in the UK or in Scotland will never, ever privatise the NHS. It's our baby. We created it. We will protect it. So enough of the scaremongering and the lies. Stop insulting the intelligence of people across Scotland, because as has always been the case throughout our history, only Labour will protect our NHS and keep it where it belongs, in public hands. But as well as letting down patients, the SNP has also let down our dedicated NHS workforce. The NHS would be nothing without our hard-working staff. They are the ones who provide the expertise and compassionate care that makes our health service so valued by patients. A failure to put a proper workforce plan in place long before the challenges of COVID is a key reason why we have this crisis today. And let's not forget, it was when Nicola Sturgeon was Health Secretary that training places for nurses were first cut, and we're still paying the price for that today. And local health services have been drastically cut under the SNP2 or have been put at risk. And one example is Lanarkshire, where this government plans to downgrade Wishaw's neonatal unit, which will result in the sickest new babies having to travel and be treated far away from their families. Meanwhile, right here in Edinburgh, accessing a GP is becoming almost impossible. In Edinburgh South, where thousands of new homes have been built, there has been no corresponding increase in GP and health services, which is why our candidate Ian Murray has been running a campaign to improve local services. And can I just say that Ian Murray has not just been a tremendous servant for the Labour Party in difficult times over the last 14 years, he has been the man that has helped resurrect the Scottish Labour Party and will be an absolutely phenomenal Secretary of State for Scotland. Just a few minutes from here, NHS Lothian had plans for 2 new medical practices for more than 10,000 patients in Liberton and Gilmerton. But those plans were scrapped by the SNP government at the 11th hour, leaving thousands of people struggling to see a doctor. And everyone across Scotland knows the frustration of trying to phone your local GP at 8 AM in the desperate hope of an appointment. So protecting the NHS is about more than just reducing the backlog, as important as that is. And the NHS of tomorrow must be rooted in local communities where Scots can easily and conveniently access healthcare services and have a greater say and input over their care. But sadly, this emergency in our NHS also comes at a human cost. I've lost count of how many times I've tried to inform the SNP's succession of First Ministers about the devastating reality of their failings. For many, it's the anxiety of waiting for a diagnosis, or the pain of waiting for treatment, or the unknown wait. For others, it's the financial burden of having to pay for private health care because they feel they have no other choice. People like the woman I met in Rutherglen, who was waiting years for her child's mental health diagnosis. She eventually had to travel to London and pay thousands of pounds for that diagnosis so her child could get the treatment they needed. Or the man I met who remortgaged his home in the middle of a cost of living crisis when interest rates have gone through the roof and mortgages are up by £2,000 a year, remortgaged his home in order to pay for a hip replacement because his bosses told him that if he didn't get back to work within 6 months, he'd have no chance of getting back to work at all. And that's why he had to go private. And for some, tragically, failures in the health service leave families mourning the loss of a loved one. And just yesterday we heard of Scotland's drug death crisis deepening, and that shames this Scottish Government. Thousands of lives have been lost, and the numbers of deaths continues to rise, as the latest figures revealed yesterday. Cuts to life-saving drug and alcohol services have led to this public health emergency, because every single day that the SNP puts its party before our country comes with the consequences for our NHS and the people who need those services so desperately. And nowhere have those consequences been more devastating than the Queen Elizabeth University Hospital. As many of you know, this is a campaign that is really close to my heart. And that is the fight to uncover the truth about the infection scandals at that hospital. I spent a lot of my time talking directly to the families impacted, in particular to the mother of Millie Main, Kimberly Darrick, who is one of the strongest, bravest people I have ever met in my life. Her daughter Millie was just 10 years old when she died after contracting an infection at the Queen Elizabeth University Hospital. Now, she was actually in remission, and she had her whole life ahead of her before it was cruelly taken away. And inch by inch, Millie's family are getting closer to justice. But let me make this commitment again. I will never stop fighting for justice for Millie and all those who lost their lives while their families faced institutional cover-up, denial and lies. If we are anything, if politics is about anything, it has to be on the side of those families and those victims, not on the side of bureaucracy and management. And that's why we'll stand in Millie Main's family. And I can confirm that our party's manifesto, which we publish next week, will set out our commitment to introducing Millie's Law right here in Scotland. This will create an independent public advocate with the authority to investigate incidents to establish the truth. And it will reset the balance between families and powerful public bodies, ensuring that bereaved families are at the heart of the response to disasters and public scandals, so that never again does a grieving parent have to fight day and night to get the truth year after year after year. And friends, 3 weeks tomorrow, on Election Day, we have the opportunity to take the first steps to save our NHS. If we win that election, Keir Starmer will form a Labour government on July the 5th. And that date is hugely significant. It's the day our NHS was founded by a Labour government in 1948. So this year, our health service celebrates its 76th birthday, and I can't think of a better present than booting out a rotten Tory government that's done so much damage to our country over the last 14 years. And what a fitting moment it would be for the NHS to return to the stewardship of a Labour government where it will be cherished and nurtured once again. We will get our NHS back on its feet. Tackling the waiting list crisis has to be the first priority. And as a result of decisions made by the SNP, NHS spending in Scotland has failed to keep up with investment elsewhere. When the Nationalists came to power, Scotland spent 17% more per head on health than in England. Now that figure is only 3%. So a UK Labour government will start the process of delivering greater investment in the NHS, and we will pay for this by closing the non-dom tax loopholes and cracking down on tax avoidance. This will deliver millions of pounds every year in health-related funding for Scotland. Funding to deliver 160,000 more appointments every year for patients in Scotland by operating additional clinics and theatre procedures in the evenings and weekends. This increased capacity could cut waiting lists, drive down waiting times, and reduce the need for patients to pay out of their own pocket for private care. And that is only possible by voting for a Labour government at Westminster. But there is so much more that we want to do with the powers of devolution as well. Because it's wrong for people to pretend that all the problems in the NHS are just down to money. It's also about how we reform our NHS so that it is fit for the future. So when we publish our manifesto next week, we will outline the work we are doing in the run-up to the 2026 Holyrood election and our vision for the future of the NHS workforce. Healthcare staff must feel empowered to offer new ideas and speak up when things go wrong, not face a culture of bullying and cover-up, as we saw at the Queen Elizabeth University Hospital. And there must be proper 10-year workforce plans put in place for the future. That includes recognising the vital skills of social care workers who have been undervalued for far too long. So our manifesto will commit to establishing a National Clinical Council of healthcare professionals who can directly advise on this and inform government on planning services, planning service delivery, workforce numbers and patient safety. This will ensure that our NHS meets the needs for future generations. And another key reform we want to see is a reduction in the bureaucracy and red tape that plagues our NHS. Today we have 14 health boards, 31 integrated boards and 8 specialist health boards. This creates a top-down, bloated, managerial-heavy health service. Bluntly, we need fewer chief executives and more doctors, and we need fewer managers and more nurses like Mags and Oliver. Alongside these measures to boost our workforce and tackle bureaucracy, we must also bring back the focus on preventative measures that has always been at the heart of Labour's approach to healthcare. Because our health service must be more than just about treating illness. We need more quality services that offer early interventions, are easy to access within people's communities, and encourage healthy living. And we owe it to our young people that they are given the best start in life. And those quality preventative services must be accessible as everyone gets older. So we want to see greater uptake and ease of access to screening services for cancer, particularly in our most deprived areas. And we need to end the ATM rush for GP appointments that I referenced earlier and bring back the advance booking of consultations. And there must be finally parity for mental health services with physical health services too. And that's why we are committed to ensuring there's a mental health professional available in every single GP surgery. And we would reform the CAMHS process to ensure that no child is turned away without support from mental health services. And to tackle our drugs death crisis, we are committed to improving access to residential rehabilitation regardless of where someone lives. And in dentistry, which I touched on at the start, we will develop incentives for newly qualified dentists to work in the areas where they are most needed so that everyone is able to register as an NHS patient. And we will build a national care service worthy of the name, working with local communities to design services and help more people live independently in their own communities. This demonstrates the role that government can play using the existing powers of devolution to fix our health and social care services for the future. But there is something else which can help get our NHS back on its feet, and we've seen it today, and that's the advancement made in modern technology. If we are to create an NHS that is fit for the 21st century, then the NHS cannot simply stand still. New technologies can help improve access to healthcare, deliver faster and more effective ways of working, and offer new treatments for patients. Virtual care can allow patients to be monitored remotely and receive treatment at home. Digital solutions can also improve the way that patients engage and access care across the health system. So we want to see an increase in the availability of online booking for appointments, routine checks and repeat prescriptions, as well as digital reminders. Tech innovations will speed up the process of tests and diagnosis, further helping to bring down waiting times on top of the impact of Labour's additional direct investment. And we need to end the ridiculous situation which means that Scotland's GPs still do not have access to e-prescribing. That's become a norm in other parts. It should be a norm here in Scotland too. For example, in England, where doctors send prescriptions electronically to the pharmacy of a patient's choice, often including home delivery as an option. It saves millions of pounds, frees up time for GPs, reduces the amount of paperwork required, and cuts prescribing errors. And for patients, it increases convenience and gives them more time with their doctor. That is the kind of transformational change that Labour will deliver, learning from best practice elsewhere to bring Scotland's NHS into the modern age. And finally, I'm also clear that we need to fully embrace the revolution taking place in data and life sciences. The work taking place here at the University of Edinburgh, as well as Glasgow, my home city, Dundee, St Andrews, and universities across Scotland, which has a huge potential to transform our nation's healthcare for the better. So our plan to secure membership of Horizon will mean that research hubs in Edinburgh, Glasgow, and across Scotland can once again benefit from cooperation between scientists in the UK and across Europe. And our life sciences sector plan will create thousands of jobs and inject growth into research and development investment. I truly believe, as the professor told me upstairs, that Scotland can be a world leader in preventative healthcare and medical research. We can lead the fight against diseases like Alzheimer's and make a crucial contribution in the battle against our nation's biggest killer, cancer. Because Scotland has always been home to world-class research, from Alexander Fleming to the team at the Roslin Institute who cloned Dolly the sheep, to Peter Higgs, who sadly died earlier this year. Scotland has a global reputation when it comes to innovation and creativity. So by bringing back economic stability and partnership from government so that we invest in development research, Labour will ensure that we lead the world once again. Now, somewhere in this city right now could be a young person who will be making the next life-changing breakthrough in medical research. So that is why Labour will back Scotland's research sector through a new industrial strategy and ensure we unlock the huge benefits for both our economy and our healthcare system. So friends, 3/4 of a century since Labour built our NHS, it now falls on us to rebuild it. And I promise we will not fail, because it's far too important for this generation and the next. We created the NHS, we saved the NHS before, and we'll save the NHS again. It's an opportunity we cannot afford to miss. So with a Labour government in Westminster, with Scotland's voice at its heart, the change our NHS needs can start the day after the election. Because we need to rescue our country from the Tories, which we can do on July the 4th, and we need to rescue our NHS from the SNP, which we will do at the next Scottish Parliament election. So every vote for Scottish Labour is a vote to make sure we get rid of the Tories, to put Scotland at the heart of a Labour government, and to deliver the change Scotland needs and to make our NHS fit for the future. We have 22 days to go out there, persuade the public of that future, and to make sure we wake up on July the 5th, presuming we go to sleep on July the 4th, some of us won't, to wake up on July the 5th to the news that after 14 years of decline, 14 years of failure, 14 years of chaos, we wake up to the news that the Tories have lost the election, that Rishi Sunak's never going back, and neither is Liz Truss, Suella Braverman, all the rest of them, and instead a Labour government has won the election, and Keir Starmer's our new Prime Minister, and we're on the journey of changing our country. Let's go win that future together. Thank you. Thank you very much. Thank you. We're now going to take some journalist questions. And Jenny, considering you were in the dentist chair yesterday and very ably volunteered for me to re-practice my dentistry on you yesterday, I think you should get to go first. So Jenny from the BBC.
That's very kind of you. Can I ask about trust, actually? Research out today from John Curtis and the National Centre for Social Research suggests trust in politicians is at an all-time low. 45% almost never trust governments of any party to place the needs of the nation above their own party interests. 58% almost never trust any party to tell the truth in a tight corner. What will you do to restore trust in politicians?
Thank you, Jenny. I think it's a really important question, and I can completely understand why trust in politics is at an all-time low. And actually, I often say that if even politicians often get skirted with politics, imagine how the public feel. And the reason why trust is so low in our politics is because for far too long now, for 14 years across the UK, for 17 years here in Scotland, we have had individual politicians put themselves before the interests of democracy, or to put their party before the country, or make promises they can't keep, or even worse, tell lies in order to divide our country and to entrench people into two camps and not accepting that actually in some parts there's grey areas and we can make progress together. And I absolutely accept that that's a huge challenge for any party that goes into any election trying to deliver a message of both hope and change. But the promise I'd make is this on how we rebuild trust. One, we're only going to make promises we can keep. I would rather under-promise and over-deliver for people here in Scotland. Secondly, we will always put the country before we put our own political party. Third, the integrity of our democracy will always go above trying to protect individual reputations or individual politicians. And fourth, we will take politics back to what it's meant to be, public service, because that's what we're in it for, is to serve the people, not have the people serving politicians, to serve the people and to deliver the change that they and their families so desperately need. Rebecca from PA. I'm happy to take a couple of questions at the end. Is that okay? We'll take the journalist questions first. Is that okay, sir? And then we'll take Rebecca from PA.
Hello. Last night on the debate, you said that you'd let Scottish people decide on independence, but you never actually said whether you'd agree with a referendum being held. So just wondering if that was something that you'd given consideration to. Thanks,
Rebecca. As I said last night, I don't support independence. I don't support referendum. And actually, if you look at the statistics, there isn't a consistent majority in favour of independence. There isn't a majority in this country that want a referendum right now, but neither is there a majority for the status quo. But there is an overwhelming majority for change. And so I'm saying directly to people, my view on independence is clear, but I recognise why so many people over the last 14 years have been driven for the escape route or driven to vote for another political party because one of two things. One, because they thought it was the only escape route from a 14-year Tory government that's done so much damage to our country, or because they thought Labour couldn't win. And that's why Keir and I have worked so hard over the last 3 years to change our Labour Party so we can look people in the eye and say, we changed our party so we can have the opportunity to change our country. And over the next 3 weeks, with hard work, humility and energy, we will continue to try and persuade people that change is possible, but only possible if we return a Labour government. But I want to say directly to those people who perhaps have voted independence in the past, voted for another party in the past, that we may ultimately disagree on the final destination for Scotland, but we can all agree we need change right now. So let's go on this part of the journey together, get rid of this rotten Tory government, and have the opportunity to change our country. I think that benefits everyone across Scotland, regardless of what side they take on that constitutional question. Paul from the Daily Record.
Thank you. If Scottish Labour wins the next election, you become First Minister, will you use the independent health sector, i.e. private hospitals, to drive down NHS waiting lists?
So a few things within that. First of all, we're going to make sure we get through the next 3 weeks and return a UK Labour government. And then we're going to spend every moment motoring towards the election in 2026, because we believe genuine change comes if we can make change here in Holyrood too, and then we can start the work of improving our NHS and making it fit for the future. Now, I think there's a difference between the role of someone paying to go privately in order, because they're stuck on an NHS waiting list, having to remortgage their home, having to take a loan, having to borrow from family and friends in order to pay for treatment, which is different from using capacity that exists to drive down NHS waiting lists. I think one of the challenges we have, though, in Scotland is that we actually have a much, much smaller private sector healthcare compared to, for example, other parts of the country, London being a prime example of that, and England being a more general example. So there is very limited capacity, actually, in the private sector that can help us overcome those issues we have in the public sector to drive down our NHS waiting lists. But what we do need to do, because it's actually probably in many cases the same staff, particularly the consultants, who are working in the NHS and they're talking up their elbows, are taking time out to go and do the exact same services in the private sector, on often occasion to supplement their incomes, but also because there's a growing demand for the private sector given the long waits in the NHS. We believe by using the additional money that's going to come from clamping down the non-dom tax loopholes, that creates the income we need in order to provide the financial incentives for those very same consultants and doctors to work in the NHS on that added time to supplement their income to drive down the waiting list. And that's the approach we would take. We're not ruling out using capacity, but our preference is to invest in creating the capacity in the NHS to drive down our waiting lists. Thanks, Paul. I'll take David from Scotsman.
Thanks very much. Health's obviously devolved, so the only real mechanism for the UK government under Labour to sort of boost or revive the NHS in Scotland is through funding. But obviously the IFS have warned that whoever is in charge will have to make between 10 and 20 billion of spending cuts by the end of the Parliament. Is the IFS spreading sort of false information about this? You've been very quick to, last night you called it false from John Swinney. And if it is all about spending and more money from Westminster to produce these appointments, is the SNP correct when it says that they're getting a raw deal from Westminster?
Thank you, David. There's a few bits of that, so let me take each part of it in turn. The first thing to say is we've seen this tactic played before by both the SNP and the Tories when it came to the Brexit referendum, when it came to the independence referendum, when it's come to general elections, where big, scary numbers are projected to the public in order to create fear and drive them towards a divisive agenda. We saw it with the £350 million on the side of the red bus in the Brexit referendum. We saw it in the independence referendum when the SNP pretended that the NHS would be privatised if people didn't support independence. We're seeing it now with the Tories pretending that taxes will go up by £2,000 for every household. And we're seeing it also from the SNP, who are pretending that the NHS will be privatised or that there will be an era of austerity if Labour win the election. All false claims, all desperate attempts to cling on to power and to scare people, which is completely and utterly unacceptable. And isn't it shameful from a political party that has said over the last 14 years that its driving mission is to get rid of the Tories, and now we finally, after 14 years, have a chance to get rid of a UK Tory government, and all they want to do is attack the Labour Party. I think it shows you the SNP politics for itself. On the specifics of the question you asked, though, what the IFS was looking at was the last budget as came from the Conservatives. And if you look at how we will have to approach the next era of public spending and public sector delivery, there are 4 different parts to it. One is what you spend. Second is what you raise. Third is borrowing. And fourth is growth. On what you spend, we are making an unequivocal commitment. There will be no austerity under a Labour government, because austerity has damaged so many communities, destroyed our country, and actually undermines the social and economic outcomes we want to see in our country. So, no austerity. Second, we've already outlined where we would raise revenue. We would not raise revenue by putting higher taxes on working people who are already facing a burden because of a cost of living crisis. We would raise revenue, first of all, by a windfall tax on the oil and gas giants who are making record profits. That would give us over £10 billion over the course of the next Parliament, a policy, bizarrely, not supported by the SNP, who want to pretend that somehow there's cuts coming down the road. Second, we would close the non-dom tax loopholes on the super rich to put more money into our National Health Service. Third, we would clamp down on tax avoidance to make sure we have more money coming in so we can invest in our public services. And fourth, let's not let Rishi Sunak off the hook. Let's not forget the billions of pounds in COVID contracts that Rishi Sunak gave to Tory donors and his pals, and that's why we will appoint a COVID corruption commissioner to get this country's money back and put it into our public services. So that's how we'd increase revenue in order to invest in our public services, not put higher taxes on working people. Third is borrowing. We've been very clear. We are not going to borrow for unfunded spending commitments or for day-to-day spending, because what's the outcome of that? The outcome of that is a repeat of the Liz Truss mini-budget, where she made unfunded spending cuts and wanted to borrow in order to make tax cuts, which crashed the economy, and people are paying a price in their mortgage as a result, where mortgage is going up by £2,000 a year. So we will borrow to invest, but it's right that we don't borrow the way that Liz Truss was proposing. And fourth, and the most significant part, is we will grow the UK's economy. The Tories have, you saw it today, flatlining growth across the country. That's a damage to our public services, a damage to our economy, and it's a damage for working people because of Tory economic chaos. But we also will grow Scotland's economy too by using the levers we have here rather than just looking to blame someone else sitting somewhere else, which is always the approach from the SNP. That is a comprehensive, detailed plan that is putting the country first and making sure we're delivering the change our country needs. And the final point I make, David, just on that, and I apologise for the long answer. The final point I make on it is the public aren't stupid. And the Tories and the SNP should stop insulting the intelligence of people across the country. And the SNP in particular should stop trying to downplay the damage done by the Conservatives over the last 14 years. Nobody believes that we can fix 14 years of a mess overnight. They all accept it will take time, and they all accept that it will mean hard decisions. But what they also all know is you only get the chance to start the change and move us in the right direction if on the 4th of July you use every vote for Scottish Labour to make sure we get rid of the Tories, to put Scotland at the heart of a Labour government, and to start the journey of change for Scotland and the UK. Rebecca for Global.
How would a Labour government tackle the drugs crisis? You've made a lot of commitments in what is a devolved system. Specifically, you spoke about drug deaths in Scotland. It's been a focus of the SNP for years, and yet things still don't seem to be getting any better. Thanks,
Rebecca, and it's a really important and serious question. The statistics are completely and utterly heartbreaking, and one unnecessary death is one death too many. And I think we have got so conditioned in our politics now where big scary numbers are published, but we've got sanitised to them because we get scary numbers month after month, quarter after quarter, year after year. But behind every single one of those numbers is a family that's left heartbroken and communities that are left destroyed. And so I think it's a really, really serious and important question. The first thing to say is we have the exact same drugs laws as every other part of the UK, but we have 3 times the numbers of drug deaths here in Scotland. What's the reason for that, which we have to address? One is how we properly fund alcohol and drug partnerships, how we support proper rehabilitation, how we challenge the scar of poverty and inequality that is damaging far too many communities across the country, how we integrate also our mental health support as well as our drug and alcohol support, because there's a connection between the alcohol death rates, the drug death rates and our suicide rates across the country. But also fundamentally, and this was something I was discussing at the medical hub at Glasgow University just at the start of the week, is we also have to recognise the relationship between family and relationship breakdown with drugs, deaths, suicides and mental health, alcohol deaths. And all of that requires a holistic approach, and that's the approach we would take. We would take it as a public health emergency, which Jackie would obviously lead for us on as part of that package of delivering what we do in the run-up to 2026 and then what we hope to achieve beyond 2026. But we want to take a holistic approach that puts the person at the front and centre rather than trying to make it some kind of constitutional divide, which shamefully seems to be the case from the current SNP government. Thank you. Sir, you wanted to ask a question? Go for it.
Thanks, that's very kind of you. I'm a 70-year-old pensioner, and I've been a member of the Labour Party for a long time. I'm currently on a waiting list for eye care for 79 weeks to
Wow.
see a consultant. After that, possibly more than a year to actually get the work done. I went to Specsavers, who charge now for a proper eye scan, and they were very, very keen to refer me to an outfit called Vision Scotland, which is an umbrella organisation for private equity groups who make millions and millions out of working class people who need health treatment. I also know from bitter personal experience, I was admitted to the Western General last September with a prostate problem, and they fitted me with a catheter. I know that humiliation and degradation of waiting to see a consultant about that, I would have had to wait till July. Going private means you pay £8,500 for the operation. Going to Vision Scotland to repair my eyes cost me £9,000 is what they quoted for that. I can't afford that kind of money. I had no choice, and I was bitter about it because my family is a working class family that supports the NHS from its inception. I had no choice but to go for a prostate operation. No choice.
Was that privately, sir, was it?
Privately, unfortunately, at the Murray Field Hospital. It used up a huge chunk of my savings. It cost me £8,500. The consultant get paid £2,000 for an hour's work. How many consultants faced with the choice of doing overtime in the NHS or getting that kind of money from the private sharks? How many are going to choose to work more time in the NHS? The guy who gave me the anaesthetist thing, he paid £600. The rest, £4,500, went straight to a private equity company that put their money offshore and don't pay a penny in tax. I hate to say this, Anna, but Wes Streeting, the shadow health secretary in Keir Starmer's cabinet, has repeatedly and time again said a major plank of reforming the NHS is letting private health care into our NHS system. He's been unapologetic about that. He was challenged on it by Diane Abbott, and they've had a spat on social media for some time. He hasn't backed down in the slightest. He's unashamedly in favour of further privatisation of the NHS. He would sock people like me and not even raise an eyebrow. And I think it's disgraceful.
So let me answer that point for you, sir. Let me answer that point for you, sir. You've raised a really, really important personal, and I want to come to that because that's the more important part. But let me just clarify the West Streeting bit first. The words used by West Streeting, I'll quote them directly. I would die in a ditch before allowing the NHS to be privatised. What we are talking about and what he was talking about is some of the innovations that we've been speaking of. It's so much of the innovation in terms of health innovation, in terms of the new treatments of the future, in terms of the machines of the future, if you think about the MRI scanners, the radiographers and all the rest of it, so much of those innovations and investments are being done in the private sector. For example, if you look at our scanners in the NHS in Scotland, they aren't built by the NHS. They're built by Canon, Hitachi, companies like that, which are all private sector companies which are investing in that innovation, and how we get that innovation and treatment into our NHS is really, really important. Well, let me address the wider point, sir, that you raised about your own personal circumstances. Please, sir, you've had your chance, sir, so let me...
Specsavers and other private firms, and that would suck money out of the NHS and out of working class pockets.
Well, let me just address the other points that you raised, sir, because I think they're important. So let's not personalise it. Let's make it about what the facts are and what the issues are. Because the fact of the matter is, you raised a really personal case about the issue with the prostate. I know from a family very close to me where someone went into with an enlarged prostate. They were only meant to wear a catheter for 4 weeks, ended up having it in for 8 months. And I swear that person declined aged 10 years in that 8 months. I've never seen anything like it. When they went back after 8 months, they were told that they would have to keep the catheter in for another 3 years before they got their prostate removed. And the only option was either keep the catheter in for 3 years or to go private and pay, like you had to do, sir, very unacceptably, £8,500. And genuinely, if that individual had worn that catheter for 3 years to wait for that treatment, they would have died. I genuinely believe it, seeing the way that person declined over that 8 months. And so they had no other option, and they'd worked all their life, been loyal to the NHS all their life. They had to borrow, embarrass themselves because they didn't want to go to their own children or other members of their family and plead to get together that £8,500 in order to get that prostate out, in order to save their life. That's the real life consequence when you don't invest and properly support our NHS. That's what we should be focused on. That's what we need to fix. Let's not make it about throwing out left-right divides in the Labour Party or about individual politicians. Let's make it about fixing our NHS. That's my mission. That's Jackie's mission. That's the Scottish Labour Party's mission. That's the Labour Party's mission. But we only endeavour in that mission if we elect a Labour government on the 4th of July. Thank you. Thanks very much. Thank you. That was great. Thank you. Thanks so much. Thank you, everybody. Thank you.